This is a scan of a CT abdomen and pelvis. This is your scout films, what we call our preliminary films, just to make sure that we have the patient positioned correctly on the table. And then from our scout films, we'll do our next series of films, which is on an abdomen and pelvis, is we call axial without. That means that we've not given the IV contrast yet. We just take the scan of them, and we can see the heart and the liver and the stomach. And you see with the oral contrast, they've been drinking that for about an hour to an hour and a half, and it shows up the organs of the body. And what the IV contrast does is it shows up the vessels of the body. So we have the contrast, the oral contrast in the stomach, and there's the spleen and the kidneys. And that's the colon, that's the spine. And we just look at it to make sure that enough of the barium is down for the radiologist to be able to read the scan. Then the next set of pictures we take are the ones with IV contrast. And what that does is, if you see the difference right here, these vessels show up. That's the vessels of the liver. And that's the difference between having one, I'll show you right here, the one that we saw before without, I'll get kind of to that same place. There's the liver without the contrast, and there it is with the contrast. And you see how different that is. So we just look at it, make sure that we've got everything the doctor needs, the kidneys, and make sure that we see it all in the colon, and make sure that it goes all the way down, and we get down through the bladder. And right here is the bladder. Then our next set of pictures, we take delayed kidney pictures to make sure that our contrast, our IV contrast, is filtered out through the kidneys. And right there it's filtering out through the kidneys. And we do that to make sure that it's going through well. And our next set of pictures that we're going to take are our delayed bladders to make sure that it has gone through the bladder. And it has. And then we give those to the radiologist. We can complete the paperwork. We can do 3D reconstructions on patients that have angiography work. What that does is that shows up the main arteries, like the aorta, your carotid arteries, and all of that. And this is one where it's like it shows the carotid arteries right in through here. And that's what that looks like, and it's a 3D image that we send also for the radiologist to look at.